You brush your hair each day, but what about brushing the rest of your body? Dry brushing is a body massage that uses a dry, stiff-bristled brush. While there's no scientific evidence to support claims, some believe it may help remove flaky skin, increase circulation, promote lymph flow, and stimulate the nervous system. Here's how to dry brush. Number 1, pick the right brush. Choose a natural bristled brush with a long handle for those hard-to-reach areas like your back. Some bristles can be stiffer than others, so pick one that fits your preference. Number 2, dry brush before showering. You can dry brush a few days a week. The ideal time is right before you shower, so you can wash away any dead skin cells and flaky skin. Number 3, start at the bottom. Use the brush on your feet or ankles and work your way upward in long, fluid strokes over your legs and arms. A few overlapping swipes per area is all you need. Number 4, focus on your midsection. Next, move the brush in a circular motion on your torso and back. Number 5, consider your pressure. When you dry brush sensitive areas like your abdomen, breasts, and neck, do so with a lighter touch. Number 6, apply body lotion. After showering, make sure you use body lotion to keep your skin moisturized. While dry brushing is considered safe, stop if you notice redness, swelling, or inflammation. Avoid dry brushing over warts, moles, raised bumps, cuts, scrapes, sores, and sunburned skin. It's also important to avoid your face, since it's more sensitive than the rest of your body. And if you have sensitive skin, consider using a dry washcloth instead of a natural bristled brush. Dry brushing can be an easy way to rejuvenate and exfoliate your skin. Your healthcare provider can provide more guidance and answer any questions.